Hi, welcome to the Professional Certifications channel. In this video, we will explore common questions asked by JCI surveyors and provide answers on the Staff Qualifications and Education, SQE.
Do you have a job description?
Yes, having a clear job description is essential for ensuring staff understand their roles and responsibilities. A job description outlines the key functions, skills, qualifications, and expectations for each position within the organization. Key elements of a job description include 1. Job title, clearly defines the position. 2. Responsibilities and duties, describes day-to-day tasks and essential duties. 3. Qualifications and Education, specifies required education, certifications, and experience. 4. Skills and Competencies, lists the necessary technical and soft skills for the role. 5. Performance Expectations, defines key performance indicators, KPIs, and goals. 6. Reporting Structure, clarifies who the position reports to and who reports to them. 7. Work Environment, describes the physical and work conditions. By having job descriptions, healthcare organizations can ensure that all staff are aligned with their roles and expectations, contributing to better performance and quality care.
How does the hospital/department prepare you to perform the work you are doing?
Hospitals and departments prepare staff for their roles through comprehensive onboarding and continuous development programs. 1. Orientation Program, new staff undergo orientation to familiarize themselves with the hospital's policies, mission, and patient care standards. 2. Job-specific training, staff receive tailored training for their roles, including technical skills, equipment usage, and workflow processes. 3. Competency Assessments, periodic evaluations ensure staff are competent in performing their duties and identify areas for improvement. 4. Continuing education, opportunities such as workshops, certifications, and online courses keep staff updated on the latest practices and innovations. 5. Mentorship and Supervision, experienced team members provide guidance and mentorship, helping new staff transition smoothly into their roles. 6. Mock drills and simulations, for critical situations, staff participate in drills and simulations to practice response protocols. 7. Performance feedback, regular performance reviews offer constructive feedback and help staff align with organizational goals. By combining these strategies, the hospital ensures that staff are well prepared and competent to deliver high-quality patient care.
Tell me about your hospital orientation/probationary program.
The hospital's orientation and probationary program is designed to ensure that new staff are well prepared to integrate into the organization and perform their roles effectively. Here's how it typically works. Orientation Program. 1. Introduction to the organization. Overview of the hospital's mission, vision, values, and culture. Key policies and procedures related to patient safety, quality care, and confidentiality. 2. Role-specific training. Detailed guidance on department workflows, job responsibilities, and expectations. Hands-on training with equipment, software, and tools relevant to the role. 3. Mandatory training. Sessions on infection control, fire safety, and emergency protocols. Training on handling patient data and compliance with regulations like HIPAA. 4. Tour and integration. A guided tour of the facility to familiarize staff with key locations. Introduction to team members and leadership. Probationary Period. 1. Performance evaluation. Regular assessments to evaluate skill competency, adaptability, and alignment with job expectations. 2. Mentorship and support. Assigned mentors or supervisors to guide and support new staff during the transition period. 3. Feedback and development. Ongoing feedback sessions to address challenges and identify areas for improvement. Access to additional training if needed. 4. Completion review. A formal evaluation at the end of the probationary period to confirm readiness for permanent placement. This structured program ensures that new employees are competent, and aligned with the hospital's standards for delivering quality care.
What is your key competency to work in this unit?
Key competencies required to work effectively in any unit are a combination of technical skills, interpersonal abilities, and critical thinking. For example, 1. Clinical expertise, a thorough understanding of medical procedures, patient care protocols, and equipment handling. 2. Communication skills, the ability to clearly communicate with patients, families, and team members, ensuring effective collaboration and patient satisfaction. 3. Problem-solving abilities, strong critical thinking to assess situations, prioritize tasks, and make sound decisions under pressure. 4. Adaptability, flexibility to handle unexpected challenges, such as high patient volumes or emergencies. 5. Teamwork, working collaboratively within a multidisciplinary team to provide seamless care. 6. Attention to detail, ensuring accuracy in documentation, medication administration, and patient assessments. 7. Emotional resilience, maintaining professionalism and compassion in stressful or emotional situations. 8. Commitment to quality and safety, upholding protocols and standards to deliver safe and high-quality care. These competencies enable staff to contribute effectively to the unit's goals and ensure the delivery of excellent patient care. Who needs to be BLS, ACLS, PALS, NRP, and also certified, and how often is it done? Certifications and their target groups. 1. Basic Life Support, BLS. Who needs it? All healthcare providers, including doctors, nurses, allied health professionals, and support staff involved in patient care. Frequency, every 2 years, or as per hospital policy. 2. Advanced Cardiac Life Support, ACLS. Who needs it? Physicians, critical care nurses, anesthetists, emergency department staff, and paramedics handling cardiac or critical care patients. Frequency, every 2 years, or as required by regulatory bodies. 3. Pediatric Advanced Life Support, PALS. Who needs it? Pediatricians, NICU nurses, emergency staff dealing with pediatric patients, and other specialists managing critically ill children. Frequency, every 2 years. 4. Neonatal Resuscitation Program, NRP. Who needs it? Neonatologists, NICU nurses, delivery room staff, and any healthcare workers involved in neonatal care or delivery. Frequency, every 2 years, or as updated by the certifying authority. 5. Advanced Life Support in Obstetrics, also. Who needs it? Obstetricians, labor and delivery nurses, midwives, and emergency staff handling obstetric emergencies. Frequency, typically every 3 to 5 years, depending on the program or hospital policy. Hospital policies. Certification frequency can vary by hospital or country, but typically aligns with international guidelines from organizations like the American Heart Association, AHA, or local accrediting bodies. Hospitals often organize regular renewal courses and provide notifications to staff when certifications are due for renewal. These certifications ensure staff are equipped to handle critical situations effectively and maintain high standards of patient safety.
How do you maintain or advance your skills and knowledge to meet patient needs and/or continuing education requirements?
To ensure up-to-date skills and knowledge, I focus on the following. 1. Continuing education, CE. Regularly participate in workshops, seminars, and certification courses to stay informed about advancements in patient care and medical practices. Enroll in online courses or webinars offered by professional organizations or healthcare institutions. 2. On-the-job training. Attend in-house training sessions and refresher courses organized by the hospital. Participate in simulation exercises and mock drills to practice handling critical scenarios. 3. Professional development programs. Join mentorship programs to learn from experienced colleagues. Engage in interdisciplinary learning through case discussions and team meetings. 4. Staying updated. Read medical journals, guidelines, and research papers to stay informed about evidence-based practices. Use trusted healthcare apps or platforms to access updated clinical knowledge. 5. Collaborative learning. Participate in quality improvement projects and multidisciplinary collaborations that enhance practical experience. Exchange knowledge through peer reviews and feedback sessions. 6. Meeting regulatory requirements. Keep track of mandatory continuing medical education (CME) hours required for license renewal or certifications. Actively engage in hospital programs to fulfill accreditation standards, such as those by JCI. By combining formal education, practical experience, and lifelong learning, I ensure that my skills and knowledge align with patient needs and the evolving demands of healthcare.
How to maintain staff clinical knowledge and skills consistent with patients' needs.
Ensuring staff clinical knowledge and skills align with patient needs requires a structured approach that combines education, training, and evaluation. Key strategies include: 1. Continuous education and training. Provide mandatory training programs such as BLS, ACLS, and other certifications relevant to patient care. Offer continuing medical education, CME, sessions, workshops, and online courses to update staff on the latest medical advancements and evidence-based practices. Conduct specialized training for departments handling specific patient populations, like pediatrics or geriatrics. 2. Competency assessments. Perform regular skills assessments and competency evaluations through exams, practical demonstrations, and case simulations. Use checklists and tools to verify staff proficiency in critical procedures. 3. Simulation and drills. Conduct simulation exercises and mock drills to practice handling emergencies and complex clinical scenarios. Use realistic case studies to enhance problem-solving and critical thinking skills. 4. Clinical supervision and mentoring. Assign mentors or senior clinicians to guide less experienced staff in improving their skills and knowledge. Encourage peer learning through case discussions, rounds, and shared experiences. 5. Quality improvement projects. Involve staff in quality improvement initiatives that focus on patient safety, infection control, and care delivery improvements. 6. Performance monitoring and feedback. Use audits, incident reviews, and patient feedback to identify gaps in clinical knowledge or skills. Provide constructive feedback and tailored action plans to address specific improvement areas. 7. Policy updates and awareness. Regularly update staff on new protocols, hospital policies, and industry regulations through departmental meetings or internal communications. Ensure access to guidelines, medical references, and e-learning platforms. 8. Recognition and motivation. Recognize and reward staff for maintaining high clinical standards and participating in training programs. By implementing these strategies, hospitals can ensure that staff knowledge and skills consistently meet patient care needs and adapt to the evolving demands of healthcare.
Is there any staff health and safety program for you as an employee?
Yes, hospitals typically have comprehensive staff health and safety programs to ensure the well-being of employees and maintain a safe working environment. These programs often include: 1. Occupational health services. Regular health screenings, routine medical checkups, vaccinations e.g., flu, hepatitis B, and TB testing. Injury management, immediate care for workplace injuries and follow-up rehabilitation support. Mental health support, access to counseling services, stress management workshops, and employee assistance programs (EAPs). 2. Workplace safety policies. Infection control protocols, training on proper hand hygiene, use of personal protective equipment (PPE), and exposure management e.g., needle stick injuries. Hazard communication, awareness of potential risks, such as handling chemicals or exposure to radiation, with proper safety measures in place. 3. Emergency preparedness. Fire and disaster drills, regular drills to prepare staff for emergencies like fires, earthquakes, or patient surges. Code Blue training, for responding to medical emergencies effectively. 4. Ergonomic support. Training on proper body mechanics to prevent musculoskeletal injuries. Providing ergonomic workstations and equipment for comfort and safety. 5. Wellness programs. Fitness initiatives, access to gym facilities, yoga sessions, or fitness challenges. Nutritional support, healthy meal options in cafeterias and nutrition education sessions. Stress reduction, activities like mindfulness training or relaxation zones. 6. Safety audits and feedback. Regular audits of workplace safety conditions and open channels for employees to report safety concerns. 7. Education and training. Ongoing training on safety protocols, hazard prevention, and handling emergencies. Updates on new regulations and best practices in occupational health. By implementing these measures, hospitals ensure that employees remain healthy, safe, and motivated, which ultimately enhances the quality of patient care.
Do you have counseling and follow-up treatment for staff who are second victims or involved in adverse or sentinel events?
Yes, many hospitals recognize the emotional and psychological impact on staff who are considered second victims. Healthcare workers experiencing distress after being involved in adverse or sentinel events. To support these individuals, the following measures are typically in place. 1. Counseling services. Access to employee assistance programs, EAPs, offering confidential counseling and emotional support. Availability of on-site psychologists or trained counselors for immediate intervention. 2. Peer support programs. Peer support teams, staff trained to provide emotional support and guidance to colleagues affected by such events. Buddy systems, assigning peers to check in and offer practical and emotional assistance. 3. Debriefing sessions. Conducting critical incident stress debriefing, CISD, sessions to allow staff to express their feelings in a safe, supportive environment. Group discussions to help normalize emotions and provide reassurance. 4. Follow-up treatment. Referrals to mental health professionals for ongoing therapy or treatment if required. Monitoring recovery and providing additional resources as needed, such as stress management workshops or resilience training. 5. Education and awareness. Training staff on recognizing symptoms of stress, burnout, or trauma to encourage seeking help. Promoting a non-punitive culture where staff feel safe discussing their experiences without fear of blame. 6. Leadership support. Managers and leaders are trained to offer empathy and actively support affected staff. Regular follow-ups by leadership to ensure well-being and readiness to return to work. 7. Systematic improvements. Sharing lessons learned from adverse events to demonstrate a commitment to improvement and prevent recurrence, fostering a sense of purpose and closure for the involved staff. By combining emotional support, professional counseling, and systematic follow-up, hospitals ensure that second victims are cared for and supported in their recovery.
Does the nursing staff participate in quality improvement programs? Or do you have any improvement program in your unit? What is your role or participation?
Yes, nursing staff play a vital role in quality improvement, QI, programs, and most units have active improvement initiatives to enhance patient care and safety. Here's how. Nursing participation in QI programs. 1. Identifying issues. Nurses are on the front line and often identify challenges such as workflow inefficiencies, patient safety risks, or gaps in care delivery. 2. Data collection. Nurses collect and document key data such as patient outcomes, infection rates, and medication errors, which form the foundation of QI projects. 3. Process improvement. Nurses contribute ideas for process changes, pilot new workflows, and implement evidence-based practices. 4. Patient advocacy. By advocating for patient needs, nurses ensure QI projects focus on outcomes that directly benefit patients. 5. Participation in QI committees. Nurses serve on QI committees or task forces, collaborating with other healthcare professionals to design and evaluate improvement initiatives. Unit-specific improvement programs. Examples of improvement initiatives: reducing catheter-associated urinary tract infections, CAUTI. Improving medication reconciliation processes. Enhancing patient education for chronic disease management. My role or participation. 1. Active involvement. Participate in team meetings to discuss QI goals and progress. Provide feedback on proposed changes based on practical experience. 2. Implementing changes. Execute new protocols or workflows in daily practice. Educate colleagues about new processes to ensure consistent application. 3. Monitoring and reporting. Monitor outcomes after implementing changes and report results to the QI team. 4. Continuous learning. Attend QI workshops and training to improve knowledge and contribute effectively to initiatives. By participating in QI programs, nursing staff contribute to better patient outcomes, enhance operational efficiency, and foster a culture of continuous improvement within the unit.
Do you receive education or training about your role in providing a safe and effective patient care facility?
Yes, education and training are integral to ensuring staff can deliver safe and effective patient care. Hospitals provide a variety of learning opportunities to prepare and support staff in their roles. These include: 1. Orientation programs. Comprehensive training during onboarding, covering hospital policies, safety protocols, and patient care standards. Introduction to the facility's mission, values, and expectations for quality care. 2. Ongoing education and training. Mandatory training. Courses on infection control, hand hygiene, and safe medication practices. Training in emergency response protocols, such as fire safety, disaster management, and handling medical emergencies. Skill-specific training. Role-specific education, such as using medical equipment, documentation practices, or advanced clinical procedures. 3. Patient safety training. Focused sessions on topics like fall prevention strategies, safe use of equipment and proper waste disposal, recognizing and addressing adverse events or near misses. 4. Continuing professional development. Regular workshops, seminars, and e-learning modules on emerging practices and technologies. Access to certifications like BLS, ACLS, or PALS to enhance clinical competence. 5. Simulation exercises and mock drills. Practice real-world scenarios to prepare for complex situations like code blue events or mass casualty incidents. 6. Quality and safety committees. Participation in committees or meetings to stay informed about new safety protocols or improvement initiatives. By investing in these educational activities, hospitals ensure that staff are well equipped to maintain high standards of patient care and safety.